Why wouldn't government, Medicare, why shouldn't they negotiate drug prices? Because this is something that a lot of people put forward, including some people in the Trump administration. The problem is that when there's a dominant single buyer, it's an imbalanced negotiation. This is sort of like a monopoly, but on the buy side, monopsony. If the negotiating payer is so dominant, and secondly, the negotiator who's paying, does Medicare care if the cancer drug is not available compared to the guy with cancer? Well, of course not. That's all part of the negotiation. You have to have the so-called skin in the game is very different for the insurance company than it is for an individual. This is a bad situation for patients. How do I know that's a bad situation? Because the data shows that this gives less drug availability in the countries that do this. And that translates into worse outcomes. More people die, more people suffer, more people have significant morbidity and disability in those systems. That's factually true. Why not cap drug prices? Because that kind of economic thing reduces the supply and the innovation. Somebody's got to pay for these drugs. I skipped past the slide. It costs $2.6 billion in more than a decade to develop a new drug. Why would anyone develop that if they're going to lose all that money? So this is the policy conundrum. The policies that promote faster drug launch and more innovation, stronger patent rights, the absence of regulation, are also those associated with higher prices. It's not a simple solution. This is some of that data that shows you, by the way, the new cancer drugs over a 5-year period, and the cancer drugs dominate the new drugs. When we look, what is the impact of government control over drug prices? Well, here's the impact. UK, France, Australia, and Canada, of the 45 new drugs that were available, all of which were available in the United States, that's how many were available in these countries. The UK has a new NHS budget impact test. They took an arbitrary number, and they said if the system is going to pay more than X, we're not going to have it available. We're going to allow ourselves 3 years to negotiate the price. What do you think the woman with breast cancer is sitting there saying? Is she going to wait 3 years for that drug? Is that okay? Point number 2 about that, by the way, for our British friends in the audience, they picked an arbitrary number as the limit. What does that imply? It implies that the broader the usage of that drug, the more it's needed, the less likely it will be approved, because more money will be spent on the drug. People have calculated that the amount of money needed to be charged, the price ceiling for a drug for Alzheimer's disease, would have to be something like $2 a month, or it wouldn't be approved. Competition reduces prices. We know that. We know it. It's a simple illustration from generics. When you add one generic drug, not much changes in the price. When you add 2, it drops immediately by 50% the price. I'm going to go forward and talk about single payer. The great enemy of the truth is very often not the lie, but the myth. This is the previous presidential campaign. The United States is the only major country on the earth that does not guarantee health care to all people. This is René Magritte, surrealist. This is not a pipe. Why is that not a pipe? Because it's a picture of a pipe. Saying someone's insured, saying someone has a right to health care has little to do with the reality. There are countries that guarantee health care. It's a right to have health care. These are the countries where people are dying waiting for health care. This happens to be the Constitution of the USSR. This is our friends in Venezuela. They guarantee health care. It's a right. NHS, celebrating 70 years. Here's their constitution. You have the right to receive NHS services free of charge. And they're proud of this. I had a video in here that I love to watch, but it takes too much time. So I just showed the picture of the opening ceremony of the Olympics in London, where this was the key celebration. The fact of the matter is that single-payer systems hold down healthcare costs by limiting the availability of medical care. That's factually true. How do they limit it? One big way is to make people wait for care. Okay? We don't have waits in the United States. It's not a feature of the system. But then this is cited. This study comes out. This is data on 5 medical fields: cardiology, dermatology, OBGYN, orthopedics, and family practice. And there are waits, it looks like, weeks to get an appointment. And when you look at this, you say, okay, well, what's going on here? Reason for the appointment, in almost all cases except for the ortho appointment, was routine well-person checkup, the least possible priority care. Yeah, but yes, there's a couple of weeks wait for that normal checkup appointment. But the New York Times says we were smug. We had the impression the U.S. had no wait times. But it turns out that's not true, quoting Robin Osborne from the Commonwealth Fund. Is there an equivalence here? Well, here's Canada. 2017 numbers. These are actually, I put these so that they match the category. And these are actual patients. These are not well-person checkups, by the way. These are people who are sick, who need care. What is the wait? To even get the specialist appointment is in red. To get the appointment with the appropriate doctor, after seeing a doctor, you've already seen a doctor. And then the total until care is initiated. 11.7 weeks for somebody with heart disease. 22.5 weeks for a gynecology appointment. 41.7 weeks to see an orthopedic surgeon. That's Canada. And if you really want to look at this, I mean, we're talking about people here, brain surgery, okay? Radiation treatment for cancer, ophthalmology, months. Hip replacement, knee replacement, these are debilitating diseases. 27.5 weeks in Canada. Cataract surgery. When people need cataract surgery, that means they cannot see. It's not that they have some mild problem with vision. He can't drive. He can't function. 20 weeks. Unheard of in the United States. The grand irony is that all over the world, single-payer healthcare has failed. And the irony is the way they deal with that failure is they go and they take taxpayer money and they pay for private care in their own countries or sometimes across borders in other countries. Here's some waitlist numbers for the NHS. I don't have to go through it except just to say that almost 20% of people that need brain surgery wait more than 4 months to get it, and almost 20% of people with cancer referred for urgent treatment in the NHS wait more than 2 months. NHS spent £12.5 billion, which are still worth more than dollars, on private care, and it's increasing, and more Brits. In fact, anybody with any significant income in the UK has private insurance. And I'm talking about people that make about $80,000 to $90,000 per year or more, the overwhelming majority by private insurance. It's only the lower socioeconomic groups that are stuck with single-payer care. Interesting fact there. The NHS is still the biggest buyer of fax machines. All over Europe, not just England, Denmark, Finland, Ireland, Italy, the Netherlands, Norway, Spain, Sweden, all pay for private health care because they have to make up for their failed single-payer government-run systems. Even in the US, the solution in our single-payer system, which is the VA, is to let patients go to private systems. Proven worse than US healthcare. Why would anyone who's rational, why would an American patient want single-payer system when it's worse than what they have. P.S. Medicare is unsustainable. No more money left for, this is the hospitalization fund, in a handful of years, really. Why is that? Because when the program started, there were a lot more workers than users of Medicare. Because of population demographics, that's dramatically changed. Medicare is very good for something. We hear a lot about the vilification of private insurers. Medicare ranks at or near the top in rejecting claims compared to the private insurers. Okay, I'm going to finish with a couple of quick slides. This is survey data. This is just a couple of extracts, just to say something else, which is Americans are different from other people. We don't all want the same thing. This is obvious. It shouldn't need to be said, but it's never really been examined. This is a survey I designed with YouGov on expectations from healthcare. This is simply comparing Americans to Brits. The ability to choose which doctors will perform a medical procedure on you, which you don't have in the NHS, just as a matter of fact. Extremely important, very important, somewhat important. Here's what the Americans say. There's a massive difference in expectation. Maximum acceptable waiting times. If you have a heart surgery need that isn't an emergency, how long was the maximum amount of time you'd wait? Americans, 52% say only 1 week. Brits, 70% are willing to wait months. It's just a very different expectation. I'm not saying one's right or wrong. You need cataract surgery to restore vision and are unable to drive or live independently. This was the specific question put forward. Americans, 63%, about 2/3, are only willing to wait up to 1 week for their cataract surgery, but Brits, 70% of them are willing to wait months. You need a diagnostic MRI for a serious underlying condition. 73% of Americans are only willing to wait 1 week. Brits, 60% are willing to wait months. Suppose you need heart surgery and you could possibly suffer a heart attack or die while waiting. This was the specific wording here. Americans are 89% are only willing to wait up to 1 week. Brits, 25% are willing to wait months. Months. Be careful what you wish for. If you even look at surveys to define healthcare satisfaction, I showed the slide, 80% of Americans say the system needs fundamental change or complete rebuilding, but nobody talks about the other countries in that survey. Not a lot of people are really thrilled with their healthcare system. One of the great mistakes is to judge policies and programs by their intentions rather than their results. That is one of the best of the many fantastic quotes from Milton Friedman. And this is my obsession on my Twitter account, Facts Matter. Okay, thanks very much.